Hi there, this is Kelly Dean from the Tummy Team, and we're talking specifically to men today and helping you understand why do men get diastasis recti. So we do a lot of education at the Tummy Team about what diastasis recti is. It's a separation of the abdominal wall, a stretching of the connective tissue that runs down the center, and it's so common in women that men get overlooked. And so we want to talk specifically about why would men get this condition. So the anatomy is important to understand, and you have three layers of your abdominal wall. You have your outermost layer, your rectus abdominis, that's the crunch muscle or the washboard stomach. Then you have your obliques, which is your middle layer, and then you have a corset that wraps around, and that's your transverse abdominis, okay? All three layers connect to the connective tissue that runs up and down the abdominal wall. And all three layers of the muscles have a job to do. The internalmost abdominal muscle, the transverse abdominis, the corset muscle, is postural, holds you up, holds you together, stabilizes your spine, stabilizes your organs, and helps you balance out your upper body and lower body when you're lifting, straining, pushing, moving. It's something that we use all day long, and it needs to be upright and connected. Unfortunately, all of us, but men specifically, often work in a lot of sitting, collapsed positions where they're not upright and elongated, they're collapsing and rounding. And then fitness opportunities tend to overdevelop the outer muscles. The crossover crunches, sit-ups, even planks with a tucked tail can overdevelop the outer muscles, and the internal muscle gets really neglected. So as a result, your body uses a whole different slew of strategies to stabilize, because you're not a jellyfish and you need stability when you lift and when you carry stuff in the house and when you do chores around your life and when you work out and when you run and all the things you do, you need to be stable and secure through here. So when you can't access that muscle because you're in a poor alignment, or you've neglected it for so long you can't even feel where that corset muscle is, and your outer muscles are overworking, you tend to use strategies that are a lot of holding your breath, a lot of straining, a lot of pushing out, even subtly pushing out and bearing down for bowel movements, pushing out and bearing down for when you lift and carry something, hiking yourself out of the bed, hiking yourself out of a couch or a deep seating position. And over time, it's chronically pushing out on that connective tissue. So there's pressure, pressure, pressure. And then the combination of that with the poor posture, the pelvis and the rib cage are not lined up and the ribs flare a little bit. And that also stretches out this connective tissue. So, and then if you did or do a lot of sit-ups and crunches, those movements also round you and push out on the abdominal wall. Even if it's subtly, that done over time actually damages the connective tissue. And so then you end up with this kind of deflated abdominal wall, or this muscle imbalance, or a bulge, or a pregnant looking tummy, or a kind of a beer belly when you don't even really drink beer. All of those things are happening, but also you're feeling likely symptoms like your low back is hurting, maybe your mid back is hurting, maybe your pelvis is unstable, maybe you have intestinal constipation issues or prostate issues, which are related. All of this is a combination of a neglect of, it's called functional core weakness, a neglect of the abdominal wall in a way that causes pressure out on the connective tissue and separates the abdominal wall. And that's what we see in men. The most common age bracket that we see for men is about 40 years old to 75. We see some outliers between that, but most of our men are middle-aged and older. And what we think is that it's over time, and you're less and less active and more sitting, that those muscles get more and more neglected. But I'm here to tell you, it doesn't matter how old you are. We've had great success with gentlemen in their 80s. It doesn't matter how long you've been dealing with this and how weak or how poor your posture seems to be. We have seen success across the board with a step-by-step rehab process. So The Tummy Team specializes in this condition for men specifically, but for women as well. And we have a program just for you called Core Foundations for Men. I'd love for you to check out more at thetummyteam.com. Get really educated about what your body is supposed to do. It's not what you think. It's not about more exercises. However, exercise can be helpful, but the wrong exercises or the wrong muscle alignment or muscle balance with doing the right exercises will get you nowhere. So we want to give you the resources to help you find success and have it be long-standing, lasting success. So you feel strong in your core, you don't have that alien bulging out, and that we can really feel like you know what's going on and we can close that diastasis without surgery. All right? So check out more of what we do at thetummyteam.com. Thank you.